You're now listening to the Adiel Gorel Show. Each episode, I'll bring you the latest news from my discussions with top health and wellness experts so that you can bring yourself into better health. Today, on the Adiel Gorel Show.
Balance of strength versus flexibility is a huge determinant, right? Our biomechanics and our posture and all the structural things, our bodies are built, of course, going back evolutionary history, the way we're supposed to move versus the way we move or don't move, as it were, in our modern day lives. And those structural components are a fundamental part. Sometimes it's a muscle or group of muscles that's too tight. Other times it's a group of muscles that's too weak. And all of these kinds of imbalances can create structural or biomechanical abnormalities that can lead or set a person up for pain.
Hi, everybody. It's a joy to be here with you again. And I'm very excited. Today we have Dr. Joshua Levitt with us. And welcome to the show, Joshua.
Thank you. It is a pleasure to be here. I wish I was in your living room there playing guitar with you, but hey, we'll do it virtually.
We could jam.
Yeah.
We could jam.
Next time.
All right. That's excellent. So, we love what you do, but we would like to know more about it. Obviously, much of your work is around the area that many of our viewers and listeners are looking for. We can empower and improve our own health and optimize it with natural solution and treating the root cause. But if you can share with us generally about how you got to this point, about your passions and what's going on, and we'll take it from there.
Yeah, absolutely. I'm glad to. I am a naturopathic physician. I have a practice here in Connecticut, and I've been practicing naturopathic medicine in a clinical context for over 20 years now, 22 or 3 years now. It started, I was one of those kids that always wanted to be a doctor. And then that plan kind of went a little bit sideways. I went to UCLA and studied neurophysiology as an undergraduate. But then instead of going down that conventional route, like many people in my family had encouraged me to, and were physicians, conventional physicians themselves, I found my way to natural medicine and studied for 4 years at Bastyr University up in Seattle, and then another couple of years of clinical residency after that. And that's led me to this place now where my practice and my whole passion is basically this. I think of it this way, that I'm kind of like standing on a bridge that's newly being constructed between alternative medicine world over here and conventional medicine world over here, trying to encourage people that there's value on both of those sides, and that they should meet somewhere in the middle, that there's really good stuff that happens in alternative or natural medicine, especially as relates to treating the cause, the underlying causes, and a lot of the safe and effective medicines we use. And there's really good stuff in Western medicine as well. And ne'er the two shall meet, right? In this country, it's like two separate worlds that often feel like they're in battle with each other. So I'm trying to heal those wounds. That's my work.
Heal those wounds, so to speak.
Yeah.
So, what you say sounds so idyllic. And I agree that there's room for the naturopathic way of doing things and the Western way of doing things. However, when things are not pure and there are financial considerations, reimbursement, insurances, things start to get a little sideways. And that's why I think it's even more important for our viewers and listeners to know that there are things they can do before the knee-jerk reaction of going to get a prescription, maybe surgery. So one example is chronic pain. Virtually, everyone, at a certain age has some pain here and there, some of it chronic. And many feel that drugs or surgery are the only solution. They may be the fastest to see something that's going on fast. but there could be many other ways to deal with pain. Can you comment on this?
Yeah, absolutely. You're right. There's a lot of incentives that are sometimes perverse in medicine on both sides of that equation as well. And yes, I think nowhere is that greater than in the search for a solution for pain, because suffering it's very motivating for people, right? And yeah, the currency of the Western medical, the conventional mainstream medical interaction is prescriptions, imaging tests, and surgical interventions. That's really that's the currency of these interventions. And I would put it this way. Maybe I can offer a metaphor. If just like there was earlier in my house here, a fly buzzing around in my kitchen, and that's my problem that I want to solve, I have different potential solutions to that problem. And one of them, the first one that I would consider, is to try to get him out. I'm a peaceful person. I'd rather not kill him if possible. Try to open the window or the door. It might be a little challenging, but it's a pretty good solution. There's maybe some risks to it, but that's kind of position number one. Then I could go up from there and I could swat at it with a fly swatter. Then I could go up from there and spray toxic chemicals at it in my air and in my kitchen. And then I could go up from there into, using a flamethrower or a torch to torch the place. All of these metaphorical solutions at increasing risk to my kitchen, right? And the idea is like they're more powerful, but they're more risky. And I think what we do in Western medicine and mainstream medicine is we just jump right up to the flamethrower right away. Big ticket, super effective, very powerful, very expensive, very potentially toxic and invasive. And I don't know, there's a seduction about those big guns that we have in mainstream medicine. And very often, lesser, I don't even want to use the word lesser, but less invasive, safer tools will do the trick perfectly well. And so that's the nature of my work.
Okay, so let's go a little more specific, not a whole lot more specific, but one of the common sources of chronic pain is lower back pain.
Yeah.
Most people have an issue. I mean, we are built a certain way. The lower back carries the whole torso. We can injure. Okay, so let's say that somebody comes to you and say, no, I have chronic lower back pain on the right side, let's say, and I don't want to take painkillers all the time. I know I don't need surgery. It's not that bad, but what can I do? So of course, you don't see the patient right here, but in general, what do you think, or what do you do with such a person?
Yeah, and that's a great question. Low back pain is probably the number one. I think it's the number one reason for visits to physicians, and it's a huge drain on the economy. So it's a very, very common problem, and one that I've seen hundreds, maybe thousands of times. So the first thing, of course, and we'll talk generally here because I'm not talking about any particular patient, but the first step I think is a bit of education. You use the word chronic, which is a good word, usually meaning pain of a certain duration, it lasting a while. What I'll usually start off with is pointing out to the person, or at least asking them whether or not the pain is truly chronic, or in most cases, is it intermittent? And most people will describe that indeed their pain is not chronic. It's not there all the time. It comes and it goes. Like it's better on the weekend, it's worse at work. It's better when they're standing and walking, it's worse when they're sitting, etc. And many of these folks are convinced that their problem is related to whatever they've seen on their MRI or their X-ray. They may have arthritis, they may have a bulging disc would be very common. And then I will point out to them that, well, if you have that bulging disc and that arthritis, those are there all the time. So why is it better on the weekends? Why is it worse when you're sitting? Why is it better when you're relaxed and worse when you're stressed? And we start to engage this conversation that there's other factors besides what we see on the image and what a doctor has told you that are determining your pain. And then we start to look at what those other factors are. I can mention several of them. One of them is excessive inflammation. We can get deeper on any one of these subjects. Another, very common, is muscle tension above and beyond what there ought to be in and around the area. And then a third, especially in a chronic case or a durational case, is fibrosis, the scar tissue formation from previous injuries. And so what I try to do is put together a protocol that, going back to my fly metaphor, that opens up the door. Try to address those factors, that inflammation or any excessive amount of it, the muscle tension and the fibrosis, and therein, and then create a protocol that's unique to that person. And that involves, a whole set of therapeutics that we can get into more detail on.
It reminds me of something from my own past. I had an injury and it left me with what you would call, based on what you just said, intermittent lower back pain.
Yeah.
And then I started Pilates and I did it very regularly. I wasn't, interested in strength. I was interested in flexibility.
Yeah.
So I was just, becoming flexible. For me, being able to touch the floor like this with straight leg was a big achievement. But I noticed the pain went away. So that must have gone to what you say about muscles in the area were too tense. Now I was stretching everything out. I don't know, just my theory.
Yeah. Well, I think your theory is right. I mean, the physical therapists put a lot of time and energy into this idea that like the balance of strength versus flexibility is a huge determinant, right? Our biomechanics and our posture and all the structural things, our bodies are built, of course, going back evolutionary history, the way we're supposed to move versus the way we move or don't move, as it were, in our modern day lives. And those structural components are a fundamental part. Sometimes it's a muscle or group of muscles that's too tight. Other times it's a group of muscles that's too weak. And all of these kinds of imbalances can create structural or biomechanical abnormalities that can lead or set a person up for pain.
When you talk about, the plan A, plan B, plan C, plan D, and where, plan A, you just, open up the door and let the fly out. It reminds me of this classic story when a patient comes to the doctor and says, "Doctor, whenever I go like this and stand on one leg, I have pain on the right side." And the doctor said, "I have a solution for you. Don't do this and stand on one leg."
Exactly right.
That's
It's very good. I've used that in practice many times. It hurts when I do this. Don't do that.
Don't do that. But I mean, is there something that you notice from your practice that is gender related? Because many men, and I have a young one here at home, love naturally to lift weights and see the muscles grow because they do grow.
Yeah.
And to see you getting big and strong. They hate working on boring places like lower back or the back of the, who cares about that? And flexibility is almost, you don't want to do that.
Yeah.
It's not manly flexibility. Right? Many women, again, I don't want to generalize along a gender line. We know that people come in all kind of, but I mean, many times I see, I actually don't want to get very strong because my belief is I'll be muscle bound, but I do, and I am flexible. Also, people tend to like what they're good at. So if you're good at lifting weights and getting stronger, you like that. Yeah. If you're naturally flexible and pliable, you like doing that, so you get even more flexible. Yeah. Do you see that in your
Yes,
in your
absolutely, and you put that very well. And whether it occurs along gender lines or not, I think there's absolutely something true to when I've seen, like I said, hundreds, maybe thousands of people. Let's just take low back pain, but it could be any joint for that matter. Some of whom have issues related to lack of flexibility. That might also correlate with big muscles, the classic muscle bound. Think of the bodybuilder. In many cases, they can barely lift their arms above their heads or even, or move terribly well, but because they're, quote, muscle bound. The muscles are hugely strong and bulky, but not terribly flexible. And that works well in bodybuilding competitions. And then the flip side of that, like the opposite of that is the yoga person, right? The yoga person who emphasizes flexibility above all. And so, on the side of increased or excessive strength with, at the sacrifice of flexibility, you have all kinds of problems that joints can have because of increased pressure on those joints, restrictions in blood flow and range of motion. But then the same thing can also be true. It takes a different form when a person's hyper flexible. So a yoga person or a person who has just joint hypermobility will often find themselves unstable, and the muscles that are supporting an otherwise unstable joint, no matter where it is, might have a greater tendency to spasm. They might be exceeding their normal range of motion and irritating it as a result. So absolutely, I mean, every individual needs to be addressed as an individual because the same shoulder pain, or what looks like the same shoulder pain, might have two very different causes in different people. So you're spot on with that.
So we talked about one of the subcategories that you mentioned, the muscles being too tight or not strong enough around an area.
Yeah.
You mentioned inflammation as well. So, I mean, I know that there are many natural ways to reduce inflammation. Some of them, if they're natural, may not be as quick, acting. And some of the Western mind has been trained to want a result right now.
Yeah.
So what would be some anti-inflammatories that you would recommend for people to use?
Sure. So I'll give you a list, but before I give you that list, I want to just make an overall point about inflammation. I think it gets a lot of bad press, a lot of press for being this terrible thing, right? Inflammation is what's causing your pain. Inflammation is at the root of basically every chronic disease, and all of those things are true. But one thing that often gets overlooked is that inflammation is a biological imperative. We have to have it. It's a necessary process. It's what defends us against infection. It's what heals us from injury and illness. It's an inflammatory response is absolutely necessary and critical to our survival. So we don't want to turn off inflammation. If we did, we would perish. Now, the problem is that many of us, for all kinds of diet and lifestyle related reasons, have more inflammation than we should based on whatever stimulus it is, right? The stimulus for inflammation could be anything. It could be a mosquito bite. You could crash your big toe into the coffee table, or you could have a chronic degenerative problem. Any of those things will provoke inflammation. And if you have the wrong diet and lifestyle, you could have more inflammation as a result. And that's what I call excessive inflammation. And interestingly, inflammation is named after fire, right? Inflammo means to set ablaze. And they have a lot of things in common too, right? So inflammation is, let's start with fire. Fire is necessary. We use it. It's maybe one of the fundamental things that made us have the civilizations that we have. We cook with it. We stay warm with it. Fire is necessary. But fire is also, when it's out of control, one of the most destructive forces on the planet. And it's very similar with inflammation. You need it, you would depend on it, but when it's excessive or out of control, it can rip us apart in all kinds of different ways. So the first step, and yes, it may not be as quick as a pharmaceutical, is to control those diet and lifestyle factors. Take away the pro-inflammatory influences and consume more or live in a way where you're exposed to more of the anti-inflammatory influences. And we can get into detail about that. I'm sure a lot of your listeners already are aware of what an anti-inflammatory diet and lifestyle looks like. So that's where we start. And then we get into the list that you asked about, right? Anti-inflammatory compounds that can work a little bit faster and more powerfully. There's an ingredient
How about we start with the list, because that's an easy one.
Sure.
And then I do want to go into the lifestyle and dietary.
Yeah, absolutely. Yeah, the lifestyle and dietary stuff is harder for people to implement, but people are looking for something quicker. And I totally get that. I mean, the job of the physician is to relieve suffering, right? And also work at that underlying cause. But you can't spend a lot of time working on that underlying cause if the suffering persists, right? So where I start in the nutritional supplement realm is with curcumin, number one. And curcumin, if it sounds familiar, is an extract that comes from turmeric. Turmeric is Indian spice, and inside of turmeric is a compound called curcumin, and it exists in turmeric at a rate of about 2% by volume. And so there's very little curcumin in whole turmeric, but when you extract and increase the potency of that curcumin, you have a very powerful natural anti-inflammatory. So that's probably number one.
By the way, I'm going to stop you right here if you
please.
don't mind. Because people look around, they shop online, and here is a turmeric, and people say, oh, I know that's anti-inflammatory, I should get that. Yeah. And here is a curcumin, and they say, well, that's also anti-inflammatory. I don't need it because I already got the turmeric. But what you're saying is quite important. Curcumin is much more a concentrated and most likely effective way to combat inflammation than turmeric, which includes it, but in very small concentration.
Yes, absolutely. And that's what the research bears that out, and my clinical experience bears it out as well. And then there's another thing to be concerned about too that people don't think about too much. Turmeric and the curcumin that comes from it is a plant. It's a root of a plant. And if you think about it this way, I sometimes describe it this way. If I took a moldy, rotten banana and I dried it, and then I powdered it, and then I put it inside of a capsule and put that capsule in a bottle with a picture of a fresh banana on it, I could sell my banana pills. And people would say, oh, these banana pills are great. And there's a picture of this beautiful yellow banana. They would never know that inside of those capsules was a rotten, moldy banana that was dried. And I could make a lot of money in profits, right? Because I would be using raw materials that are cheap, basically garbage, right? You could never tell the difference inside of a capsule. And I hate to tell you or your viewers, listeners, that this is the sad reality of the herbal medicine marketplace. You can use junk, garbage, moldy, rotten, toxic raw materials that are grown in toxic soils, that are produced, that are extracted using toxic solvents, and many people anybody would never know that that's what's inside of those capsules. So one needs to be very, very careful about the source of the raw materials, and reputable suppliers are in short supply. And so that's another problem with the herbal medicine marketplace when it comes to turmeric and curcumin supplements.
Okay, but now, and again, I'm one of our viewers, listeners. Now I'm feeling very defeated and deflated because I'm full of motivation. I want to get curcumin. I want to get this. Now, that what you said makes perfect sense. And because we know every industry in the West, at least, is driven by profit. And you don't need to be a mathematician to know that if you use very lousy and cheap raw materials, your profit margin is going to be higher. So now, as the viewer, I'm lost. What should I do?
Yeah. So I don't want this to, of course I'm a co-founder and the medical director of a company that produces nutritional supplements, but I don't want this to be a sales pitch of any kind. I would just tell you what's been my experience, right? That's really what I think is important for your listeners to know. So when it comes to curcumin, there's a particular proprietary extract. It's not I don't have any proprietary rights to it, but I put it in my products. It's called BCM95 curcumin. You can write that down, BCM95 curcumin. It's a proprietary extract. And this extract has curcumin concentrated to 95%. So like I told you earlier, curcumin exists in turmeric at 2% in raw turmeric root. We're talking about now 95%. And then there's some curcumin essential oils that are added to BCM 95 as well. It makes it a highly absorbable, highly potent curcumin extract that I find, and there is a lot of clinical research. I think there's up to over 50 studies at this point on humans and animals on BCM 95. So that's an example of a proprietary extract where industry and research has collaborated and created a product that people can trust. And so that hopefully alleviates some of that sense of defeat. I didn't intend to fearmonger or make people feel defeated, but rather to just make them feel empowered. And BCM 95 curcumin is one way to do that.
Well, look, we are just to say BCM 95. Is that a generic term that you can find and some people are making it?
Yeah, so it's a proprietary extract. So there is a company that produces this, and then other companies can get access to that raw material to put inside of their products. And that's what I have done.
Okay, I'm going to go out on a limb here. We are not meant to sell or endorse people who are selling, but if I have the urge to know, I'm assuming our viewers will. So give me the name of the company, and I'm asking you for it. So it's not like you are plugging something. I want to know.
Sure.
I want to buy good stuff.
Yeah. So my company is called UpWellness, and the product that I put BCM 95 curcumin inside of those capsules is called Golden Revive Plus. Golden Revive Plus, and it includes BCM 95 curcumin along with other well-sourced raw materials as well. And that's the product that I use. It's been a best-selling product for many years for our company, and it does a great job addressing the kinds of musculoskeletal pains that we've been talking about here today.
Okay, so there are other names that have been floating around for decades. Bromelain, quercetin,
Yeah.
boswellia. Can you talk about those?
Yes, absolutely. Let's go in order. Bromelain. Bromelain is an interesting compound. It's a digestive enzyme, and it's found in nature in the core and the stem of pineapple, which is a bromeliad. That's why it's called bromelain. It's also, and many people don't know this, bromelain is the active ingredient, the main ingredient in meat tenderizer. So if you buy meat tenderizer at the grocery store, it's bromelain. And what people use that for, interestingly, is you sprinkle it on a piece of meat, a steak or something that's too tough, and it will make it more tender. It will chemically digest the toughness, which is called fibrin, inside that piece of meat and make it more tender. And it turns out that bromelain does this very same thing inside of our bodies. When you eat or consume bromelain, it gets absorbed through the digestive tract into the bloodstream intact, and it exerts anti-fibrotic, meat tenderizing activity in our bodies, which is why bromelain is a favorite ingredient of mine for musculoskeletal pain as well.
Okay, so that's bromelain.
Yep.
Now, bromelain can be taken after some trauma or injury, and that I know, again, from my limited knowledge, but let's say now it's been a month and your injury, there's still some inflammation there, but it's much reduced. Will bromelain still be effective after a month, or is it more like a first few days type of a thing?
Yeah, so you're right. Bromelain is often used in the acute phase of injury, whether it's burns, any kind of injury that would leave a scar, whether it's an external skin surface scar or an internal scar, which people don't think about scarring on the inside, but of course it happens as well. Muscles, ligaments, tendons, any injury will scar, and that scar tissue is made of fibrin, which has a different orientation, right, than like a normal parallel muscle fibers. They're well arranged in a parallel fashion, whereas scar tissue is more bundled up, and it can restrict range of motion. That's why scars don't behave the same way as the tissue that they replace does. And so, yes, bromelain is good in the acute phase after an injury to minimize that scar tissue formation, eat up some of that fibrin, and help the scar orient along the same axis as the original tissue. But it can absolutely be used longer in the duration. And I've used it, you said a couple of months or a month after an injury. Talk about 10 years after an injury. Many times people didn't appropriately rehabilitate an injury, whether it was a musculoskeletal one or otherwise. And bromelain still works even if the injury is years old.
That's very good to know.
Yeah.
So let's move on to the next one.
Yeah, the next one on your list was boswellia.
Quercetin.
Oh, quercetin. Okay, I'll go to quercetin first. Quercetin is a bioflavonoid compound. It's found in foods. It's found in onions. It's found in apples. It's a bioflavonoid, and it has direct action against many of the same targets that pharmaceuticals target for inflammation. So NF-kappa B, and I could get all biochemically fancy here with the names of cytokines and leukotrienes. These are biochemical targets for inflammation, and pharma is always looking for laser-focused targets at these, at these different biochemical enzymes and compounds that suppress inflammation. And quercetin targets many of them. It's sort of like a shotgun compared to a rifle as an anti-inflammatory. Plus, it's a powerful antioxidant as well, and oxidation is part of the inflammatory process and certainly a component of a risk factor for chronic pain as well. So quercetin, fabulous bioflavonoid compound, and almost always a part of musculoskeletal pain rehabilitation protocols for me.
Okay, so somebody just got some sort of a trauma, injury. They are starting to take bromelain. Should they also take quercetin?
Yeah, you ask a good question, right? The question is, and we have in our Western minds, we love monotherapy, right? Like taking, and we love to study it this way. Here's a drug, it works for this problem. We can conduct a double-blind, placebo-controlled trial based on the proposed action of that substance on that endpoint. Natural medicine doesn't work like that. It shouldn't be studied that way. We use multimodal therapies. This is the way that natural medicine has been practiced all over the world throughout history. Chinese medicine, Ayurveda. You rarely see herbal medicine doctors prescribing singular monotherapy. It's almost always, especially for chronic complex problems like this, using a complex or a formula that has different herbal or nutritional ingredients in it that all sort of target different components of the problem. And so, yeah, generally speaking, I mean, there are times where monotherapy is appropriate, but generally speaking, for musculoskeletal pain, I'm in favor of the complex, multimodal sort of formula approach. And that's the reason why I designed Golden Revive Plus with the ingredients that I included in it.
Oh, it includes quercetin as well?
It includes quercetin as well, yeah.
Okay, so I've noticed that people have been saying that quercetin also helps with shortness of breath, seasonal hay fever type things. Is that what have you seen?
Yeah, so quercetin is in addition to its effects on musculoskeletal pain and oxidation, it's known as what herbalists call an immunomodulator. And so, yes, it is. I say immunomodulation because it's different than supporting or suppressing. It's sort of modulation is sort of like balancing, and quercetin is a well-known and well-described, well-researched immunomodulator, which is why we use it, yes, in all sorts of different respiratory and other immunological problems.
Okay, so let's go on to the next one.
Yeah, the next one on your list was Boswellia. Boswellia serrata. This is a really fascinating herbal medicine with an ancient history. It's biblical. It's frankincense. Boswellia is also known as frankincense. It's the resin from a tree. And this resin also has anti-inflammatory compounds inside of it that target a number of different of those similar but different ones than what quercetin targets. And interestingly, there's been a few legitimate published in the conventional medical literature studies on Boswellia that show it works to reduce pain and disability, as well as many of the common pharmaceuticals that are used for people who have joint pain. And it also seems to have an effect on this enzyme that's called MMP, matrix metalloproteinase enzyme, which breaks down cartilage. So when cartilage breaks down, the MMP enzyme is kind of like it's almost like a termite eating away at that cartilage and causing its, integrity to decrease. And Boswellia appears to help improve cartilage integrity and reduce inflammation. So an herb that's been known for centuries to herbal healers all over the world, and only more recently becoming known to modern Western science. And it's a powerful tool for sure.
Stay tuned for part 2 of this interview. Thank you for joining us today. I know you love what's coming next in part 2. Be sure to click the subscribe button for more videos.